Hello, my name is Karina Griffiths and I am the admissions tutor for Midwifery in Chelmsford.
Hello, my name is Celeste Hollands and I'm a third year midwifery student.
This is a video to help you with your midwifery interview. So firstly, well done for getting to the interview stage. This video aims to give information about the interview process with hints and tips about how to prepare for your interview. So why do we interview? Firstly, it's a professional requirement of the Nursing and Midwifery Council, but also it's a chance just to get to know about you and the personal values and qualities that you have that will make you a fantastic midwife. It's also a chance to get to know a bit more about Anglia Ruskin University.
So Karina, what would you say students need to be looking into before coming to the interviewing process?
So they could look into the Nursing and Midwifery Council. They have a website. They can also look into the Royal College of Midwives and see if there's any up-to-date or relevant publications or documents that might be relevant to their interview. They could also look into relevant news articles or just see anything about midwifery that's in the news.
Within midwifery, we base all we do around the 6 C's, which are care, commitment, competence, compassion, communication, and courage.
Try to base your answers during your interview around the 6 C's and show when you've demonstrated these qualities. So Celeste, can you tell me about when you've demonstrated one of the 6 C's?
So when I was in sixth form, I had to show real commitment. Sixth form is a really difficult time and A-levels are really difficult, and those of you who are doing A-levels will understand it. And I had to give up a lot of my time to commit to the thing that I was wanting to do, which was to become a midwife.
So some tips for before your interview. Make sure you research the role of the midwife thoroughly and you understand and can demonstrate your passion for the profession and really why you want to be a midwife.
So the night before, what I recommend is that you get a good night's sleep and that you've got everything downloaded and everything prepared. So you have Teams downloaded and that you kind of go into it with an open mind. Remember, it is a very professional interview, but also they just kind of want to get to know you and what you're kind of about and your personality. So I'd recommend that you kind of get everything sorted, and then the day of, remember to dress smartly, sit somewhere appropriate with like good lighting, make sure your sound and everything's working, and log on into Teams and then kind of wait in the waiting room, and then you'll be invited in.
So before your interview, we would recommend that you attend an open day or a taster day. This will give you the opportunity to meet some of your lecturers, come to see what facilities we've got and meet some of our current students and learn a little bit more about student life. So what can you expect from your interview? The interview will be held on Teams with both lecturers and trust partners present. It's a multiple mini interview, which means there'll be different stations virtually and you will move throughout those virtual rooms. Each person will ask you a couple of questions, and please don't panic. It is just a chance for us to get to know a bit about you, what qualities you're going to bring to the role, and why we should pick you to be one of our student midwives. One of the stations will be with your admissions tutor, who will ask to see some photo ID. So it's important that you have that to hand and that your camera is working so we can see that clearly. We'll also give you an opportunity to ask us any questions about placement sites, university, anything you like. On your interview, there will be a series of questions and scenarios. So we're looking for your understanding of the role of the midwife and your motivation to do this degree. We're interested in your approach and your answers and your communication skills. We're assessing your decision-making ability as well as your values. So we would like you to support your answers with personal examples and experiences, all underpinned by the previously mentioned 6 C's. So we're now going to do a mock interview. This will give you an idea of the sort of questions that you might be asked on the day. So Celeste, you're a student midwife working on delivery suite when a service user comes to the door. You haven't looked after this person and you don't recognise them. What do you do?
So our wards are very well protected for safety reasons. And so if I don't recognise someone at the door personally, then I will say to the service user, I am really sorry, but due to safety of the women, babies, partners on the ward, I will request that you just wait at the door for a moment and not let them in. And then I will go to the front desk and I will speak to whoever's there and just kind of see if they're on the list of who's allowed in, who's not allowed in, and then I can allow them in. I will apologise to them because it's not very nice to have a door closed on you, but also they should understand the reasons behind it, and I'll make sure I explain myself to the reasons behind it, that it's a safety reason, and that I'm sure they also appreciate that safety as well.
That's lovely. So is there anybody else that you could speak to?
So I'd either speak to any of the midwives or maybe the coordinator, if she's in the office, or I could even just go to the board and have a little look to see if I see any names on the board. But yeah, probably the coordinator.
It's important to note that you don't have to have direct healthcare experience to be successful at interview. The 6 Cs can be transferable to any scenario within your life, from working in shops to hairdressing to being a stay-at-home parent, or even being in sixth form. You will have experienced different scenarios that you can relate those 6 Cs to.
Within the interview and within the mock scenarios, what your interviewer will want to know is, what do you know? What do you know about the question, and what do you know about what they've asked you? And what should you consider? So when you're answering this, just think quite clearly and take your time to actually really think about it. You don't need to rush into it, and they're not going to judge you if you just need a minute just to think about what they've asked. Why have you answered that as well? Why have you answered it the way you have? And what are the implications? So, for example, with my case study, is that I'd need to consider that actually it's quite rude to shut a door on someone, and they might not take that very nicely. But once again, communication, one of the 6 Cs, is really valued there and really needed. And once again, what values within your answer? So what informs your answer?
So Celeste, can you tell me how you felt on the day of your interview and give any hints and tips that you've got?
So on the day of my interview, I remember feeling really scared and really nervous. It was the first interview that I had for a university, and so I didn't really know what to kind of expect. However, I remember everyone making me feel really comfortable and just kind of having a bit of a chit chat with me just to begin with, just to kind of calm some nerves. And I think what helped as well is that before my interview, I actually did a bit of research, just so I had a little bit of basic knowledge in case they asked me any questions. And so I researched what the Nursing and Midwifery Council was and what they stand for, what their values are, as well as what the role of the midwife actually is. So I knew that, and I would then understand that for any questions I was asked. I'd also recommend remaining professional. You can be really nervous sometimes, and you can get a little bit stuttery, and that's completely fine. Just remember to breathe and take your time.
And my hint and tip would be to relax. We're not trying to catch you out. We're just trying to get to know a bit about you. On the day of your interview, remember to smile. Have positive body language. Practice active listening. If you're unclear about anything that we've asked you, just ask your interviewer to repeat the question. Nobody's going to judge you for that. Look smart. Even if it's virtual, we can still see what you're wearing. And ask us any questions that you've got. We're happy to answer.
So some things I don't recommend you do. Please don't wear your PJs to your interview. It's a very professional interview, so sit at a dining room table or a desk with some smart clothes on and remain professional throughout. Learn the answers to the questions they're going to ask you. It's really important that you have a basic knowledge of what you're interviewing for. And also, don't be late. Arrive 15 minutes early and then kind of join the waiting room and wait to be invited in.
So what happens next? Your interview is done and you can now relax. The scores will go over to our admissions team, who upload them to UCAS, and the results will be available on your UCAS within 3 working days. What happens if you're unsuccessful at interview? Firstly, please don't be disheartened. You'll be provided feedback and you can work on your application for next year. We are more than happy to receive a new application from you the next academic year. Other than this, you might be offered a place on a different course at Anglia Ruskin University.
What's next once you've been offered a place? So what you'll need to do is you'll need to accept your offer via UCAS track. You'll need to sort out accommodation and complete your DBS and occupational health check. You'll also need to notify admissions for any changes to your circumstances.
Thank you for watching. We wish you all the best. Good luck.
You've got this.